Hello, everyone. It's 1 o'clock, and I wanted to welcome you to our latest webinar. I just wanted to go over some housekeeping things. I am Kim Hines with Grossman Hines, and I'm the Outreach Coordinator for Access Health Connecticut. If you have trouble hearing, and if you find your computer audio component is experiencing difficulty, you can telephone in instead, or you can just watch. If you have any questions, we're going to answer questions at the end of the webinar, but feel free to type them into the chat box whenever you have them, and then we'll address them at the end. I wanted to read a statement from Access Health CT CEO Jim Wadley about the latest election. You might be wondering about ACA. CEO James Wadley would like to remind Connecticut residents that currently there are no changes to the ACA law. If you have health insurance through the exchange, you will still be covered. If you don't, we encourage you to reach out and enroll. If there's any future change, we will adapt and evolve with the best interest of our consumers at the core of every decision we make. As for right now, it's business as usual. Open enrollment is happening now. Customers are enrolling, and we encourage them to continue to do so until the final enrollment deadline on January 31st, 2017. And excuse me, I'm just experiencing a little bit of, here we go. Okay, we're going to go get started on reaching and assisting LGBTQ communities. And as our guest, we have Katie Keith from Out to Enroll. I'm going to hand it over to Katie right now.
Excellent. Thanks so much, Kim, and happy Monday, everyone. Monday of a short week, if you're mercifully short, if you're feeling anything like I'm feeling today. So I'm especially grateful that you are willing to kind of spend the next hour or so with us talking about what I think is a really important issue of reaching and assisting LGBTQ communities. This is a webinar that we've done in partnership with Access Health CT before, and they brought us back to do it one more time just to make sure we're getting the word out to as many folks as possible. For those of you who aren't as familiar with some of these issues, I would sort of encourage us to make this a safe space. We know folks have different levels of familiarity of working with LGBTQ people, and so if you have questions, this is really the time to bring them. Consider this webinar, consider the next hour sort of a judgment-free zone, if you will. So if you've got questions, definitely put them in the chat box. You could send them directly to me, I think, so no one sees them and things like that. But if you have questions, we definitely want to answer them. I think from there, we can just sort of go ahead and get started. And Kim, I think if you could just advance the slides for me, that'd be great.
There we go.
Perfect. Awesome. I'm sure you are all thinking, okay, that's great, Katie. Who are you? What organization are you with? And what sort of makes you qualified to talk about this? You guys will have to excuse me, I'm having a bit of a head cold today. Excuse me. So Out to Enroll is a national initiative. I'm actually based in Washington, D.C., and we focus entirely on LGBTQ outreach and enrollment under the Affordable Care Act. Our whole goal is connecting LGBTQ people with health insurance. The reason that we exist is because we did a study back in 2013 that showed that LGBT people are far less likely to have health insurance than the general population. There's a variety of reasons for that, of why people just did not have coverage, but about 1 in 3 low and middle income LGBT people did not have health insurance in 2013. It was very, very high. At the same time we did that research, we also looked at messaging. And I think it's sort of unsurprising, but what we learned is that LGBT people actually need a few additional messages to motivate them to enroll in health insurance. It's pretty similar to many of the other underserved communities that many of you are already working with. But for LGBT people, folks need to see images of same-sex couples, for example. They need to see words like non-discrimination. They need to know that health reform includes them. And so we had this data back in 2013, and we were sort of scratching our heads and going, okay, we know this is a big disparity, and the community has specific messaging needs. Who's going to do that work? And so we created Out to Enroll in September of 2013 and have been around since then. Again, solely focused on LGBTQ specific work. We work all across the country. Like I said, I'm based in DC, but we are always happy to partner and support you in all the things that you're doing and develop a lot of great LGBT specific materials. If you have not checked out our website, it's at the bottom of each of these slides, so you can check it out during the webinar or later. And Kim, if we could go to the next slide, that'd be great. Perfect. So what are we going to be talking about today? As I mentioned before, a lot of folks have different levels of familiarity with working with LGBT people. So I want to just kind of start with what I'll call LGBT 101, just to make sure everybody's on the same page. We know there's a lot of questions about terminology, you know, what are the right words to say, and what does it even mean when I say LGBT? So we'll start with that. After that, I want to talk a little bit about some of the barriers that LGBT people have faced in the past. To the extent that you've been an sister for a while, you've been out there doing this work, you know just as well as I do that a person coming down and sitting across the table from you in their enrollment appointment is sort of not a clean slate, right? A lot of us bring a lot of baggage with us about maybe our experiences with healthcare, with health insurance in the past, and we know that baggage helps determine whether that person's going to have a successful enrollment experience or not. And so we want to give you more of an understanding of what kind of baggage an LGBT person might have if they're sitting down across the table from you. And then we'll sort of end with just some really practical tips, especially when it comes to the application. A good example is if you're enrolling a transgender consumer, for example, and you get to that gender question, do you check male or female? And there's an answer to that question, and we're going to talk about what it is. But I think the whole point of our training today is so that you as an assister feel as confident as possible that you are able to assist whoever walks in the door, whether they are gay or straight or transgender or not. This is all about you all feeling confident that you know the answers to the questions and you can give the best help that we all know that you want to give. And Kim will go to the next slide, please. Great, so I just want to kind of launch into this LGBT 101. So what do I mean when I say LGBT or LGBTQ? That really stands for lesbian, gay, bisexual, transgender. And then the Q can be for queer or for questioning. Sometimes it can vary depending on who's saying it. And I will say a lot of times you can see this acronym being much longer. Sometimes you might see LGBTQIIA, etc. I've been told the acronym could be, 27 letters long, which I think is surprising to many of us, but shouldn't be, because the LGBTQ community is just very diverse. There's a lot of different identities. There's a lot of different types of people represented in this broad umbrella. And so I will just probably be saying LGBT today just because it's easier, but please know that I mean everybody when I say that. And so we'll just kind of talk through these words. Lesbian is a word used to describe a woman who is romantically or sexually attracted to other women. Gay is typically used to describe men who are romantically or sexually attracted to other men. But gay can also kind of be an umbrella term. You might hear someone just say the gay community, and they're sort of talking about everyone. Someone who's bisexual is someone of either gender who is romantically or sexually attracted to people in both genders. And then someone who's transgender, which we'll talk about in quite a bit more detail, is someone who's what we call gender identity, this sort of deeply felt internal sense of who they are and what their gender is. It's that feeling when you look in the mirror and you just know who you are and what your gender is. That gender identity is different from the sex they were assigned at birth. And as you can imagine, there's a lot of healthcare implications for transgender people that we'll want to talk a little bit more about today. And we do have the word queer questioning up there. A lot of folks, queer, comes off as sort of a very negative word for, especially I would say for older generations of LGBT people. Queer was sort of a slur, it was an insult, it's not a very nice word or something that you would want to use. However, language changes over time, and queer is one of those words, especially amongst young people. So these days, for younger people in particular, the word queer is actually a positive word. It's sort of a reclaimed word that means, you know, I don't have to tell you if I'm L or G or B or T. I'm just queer, which means I'm just different. And so, you know, the way that might come up in an enrollment context, for example, is if you're out tabling at, say, a community college and you see signs for the Queer Student Alliance, which is what a lot of the LGBT student organizations are called these days. I think that's a good flag. You know, we don't ever expect you to be using these words in enrollment. You know, you should probably not be saying, like, are you a lesbian or are you queer? Those words should not be coming up. We, again, just want to kind of give you the vocabulary so that you feel prepared. And so a lot of what I'm talking about has to do with two big concepts that we think it's really important to understand. The first concept is something called sexual orientation. And I'll just start by saying that everybody has a sexual orientation. That includes all you straight people who are on this webinar with us. You also have a sexual orientation. It's heterosexual, right? So sexual orientation is all about sort of who you love, who you build a family with, who you have sex with. It's all about you in relationship to other people. So words like straight, bisexual, gay, lesbian, all of those words are words used to describe sexual orientation. It's really you and how you feel about other people. At the same time, we have something that's completely separate called gender identity. And just like sexual orientation, everybody has one. Everybody on this webinar has their own gender identity. And it really is this deeply felt internal sense of who you are and what your gender is. It's that feeling when you wake up every morning and you look in the mirror and you feel a certain way about what your gender is. For most people, that gender identity matches the sex you were assigned at birth. So maybe every day I look in the mirror and I feel female. My gender identity is female. That might mean that I dress a certain way or wear my hair a certain way, or it might not, but my gender identity is female. And that's true for most people, which is, you know, is consistent with the sex I was assigned at birth. But for a lot of folks, for transgender people, that gender identity, that feeling when you look in the mirror, that deeply felt internal sense of what your gender is different from the sex assigned at birth. And we're going to talk in a little bit more detail about this. I hope it doesn't sound too much like I'm just giving you definitions. The reason that these two concepts are so important to us, sexual orientation and gender identity, is because one of the most significant things the Affordable Care Act has done for LGBT people is to prohibit discrimination based on sexual orientation, which is who you love, and gender identity, which is who you are. So when we're out talking to LGBT community members, that's one of the things we always say, is that Obamacare means no discrimination based on who you love and who you are. And that really, really resonates with folks. So just something we want you to sort of keep in mind and have a good understanding of as we continue on. And Kim, we can go to the next slide. Great. And so I want to just drill down. A lot of folks are maybe not as familiar with some of the transgender specific issues that are out there. And, you know, I'm pretty confident anybody who is on this webinar, anyone who's out there doing the good and often difficult work of getting healthcare to people is a good person, right? All of us are doing really good work and we're trying to help people. We're all in that business. And so, you know, I'm confident that everyone here is a good person. We all want to do the right thing. We don't want to offend anybody. We don't want to embarrass anyone. But what we've heard is that a lot of folks just don't know the right words to use. They don't know the right things to say, or they feel uncomfortable that they are going to offend or embarrass someone. So we just want to give you a few more, a little bit more of the terminology to use, just so, again, you feel prepared if someone were to come in and need your assistance. So I'll say it one more time. Someone who's transgender is someone whose gender identity is different from the sex they were assigned at birth. This can often sort of result in two different things. You can have transgender men. So a trans man is someone who was assigned female at birth and lives and identifies as a man. Trans men are men, so you'd want to use male pronouns, words like he, him, his, sir. A good example of a trans man is Chaz Bono, that I think a lot of folks are familiar with. I think it's Dancing with the Stars, Chaz was in, something like that. mess it up. You can also have trans women. So a trans woman is a woman who was assigned male at birth. Trans women are women, so you would want to use female pronouns like she, her, hers, ma'am, that kind of thing. A good example that most folks are familiar with is Caitlyn Jenner, or Laverne Cox, as someone who's on Orange is the New Black. Is a great actress. And I'm being very sort of binary about this. I'm sort of suggesting that there's only male and there's only female, which is not quite true, right? We know gender is much more of a spectrum than that. And so you also have a lot of folks, particularly young folks, I would say, who identify as something called genderqueer or gender nonconforming or non-binary. All those words sort of mean something similar, which is to describe someone who does not identify as exclusively male or exclusively female. Someone's going to feel maybe more in the middle, right? And in that case, someone who identifies as one of these words might use pronouns like they, them, or theirs. And so would not use he or would not use she, but would prefer a sort of a gender-neutral pronoun like they. So as we're doing this, I just wouldn't want you to ever be surprised if someone came in and said, my pronouns are they. I want you to think back like, oh, Katie said this might happen. It probably means the person is gender nonconforming, for example. And Kim, we can go to the next slide. Great, and so I just want to touch a little bit, we get a lot of questions about this, which is the process of gender transition. So if you are transgender and your gender identity is different from the sex you were assigned at birth, many, but not all transgender people might take steps to really transition from one gender to the other. And we really do kind of prefer that phrase of gender transition. I think a lot of our minds go kind of right to surgery, right? They had the operation. Some of that might be natural, but I think it's helpful to think that there really is a lot more to the process of gender transition. There's really a social component. If you are transitioning from one gender to the other, you might start dressing differently. You might wear your hair differently. You might start going by a different name. There's also a legal component. So if you think about all the different identity documents that we all have, you've got a passport and a driver's license and a birth certificate and a social security card and a library card and, all kinds of crazy documents. If you are, again, transitioning from one gender to another, it can be an extremely difficult process to update all of those identity documents. It can depend on, in some cases, you might need a court order. It can be very expensive. There might be fees involved. So for many folks who are even able to do it, it can take years to get all of your documentation updated to match your gender identity. And so the reason we want to put that out there is this comes up quite a bit in the enrollment context because it's quite common for a transgender consumer to walk in and, I could walk in and I could appear, say, hi, my name is Katie, and appear very stereotypically female in front of you, but it would not be shocking for my driver's license to say Richard, for instance. So it's quite common for trans people to not have ID that matches their gender identity or the way that they're sort of appearing in front of you. So again, if that happens, I don't want you to be shocked. I want you to think back like, okay, I think I know what's going on here. Katie said this might happen. Don't, treat the person with respect, and it doesn't mean it's fraudulent. It doesn't mean all these things. You can sort of test the waters, but it's quite common that people don't have ID documents that match their gender identity. So just something to keep in mind. And again, we're going to talk about what you do on the application when you get to those questions for both name and gender. The last sort of component of transition is kind of the medical component. And again, folks are like, oh, the surgery. What I'm here to tell you is that most transgender people do not actually need surgery. They don't get surgery because it's not medically necessary for them. What most people want access to is things like mental health care and hormone therapy. Those are really some of the big things that we get asked a lot of questions about. Less of a focus on surgery because most people don't need it, more on mental health care and hormones. And we can go to the next slide, please. Okay, So again, I feel like I'm giving you a lot of definitions, and I just want to want you to keep in mind these are real people that we're talking about. Transgender people are real people. I'm convinced that many of you have helped or worked with trans people in the past, whether you have known it or not. And so these are just some examples of transgender people, both celebrities and people we've worked with in the past. Just so you can sort of see, these are real folks with real lives, and it's very important to treat people with respect. I think the other thing these photos show is, you would not know from looking at any of these people if they were transgender or not. And so that is something to keep in mind. All the sort of cultural competency that we're talking about today, sort of being sensitive and open to people's needs, it's going to be important because you just might not know if you're serving someone who's transgender or not. So you're just going to want to be very respectful and polite in everything that you're doing. And we can go to the next slide, Kim. Okay, I just want to give you a few more sort of tips. I don't want to overly focus on this slide about things you shouldn't say. The last thing I want is for you to walk away from this webinar and go, oh my gosh, there's so many rules that you have to follow when working with LGBT people, because that's definitely not the case. But we do want to give you just some tips, and we want to make you sound a little bit hip, and of course make it sound like you have comfort and familiarity with working with LGBT people. So, we don't recommend that you use the word homosexual anymore. It's sort of fallen out of favor. There's nothing wrong with the word, but it really comes from a time when being gay was considered a mental disease or a mental illness, right? It's sort of overly medicalized. So instead of homosexual, we're going to recommend that you use gay or lesbian, depending on if you're talking about men or women. Same thing with the word transsexual. I would just put a big X through that word. No one really uses it. And the best description I've actually heard is that transsexual is the word the medical community gave to transgender people, and transgender is the word they picked themselves. And so, again, you're going to want to be sort of respectful of these kinds of things and instead say transgender or simply trans, which I'll probably be saying both of those today. Same thing with atransgender and transgendered. Gender identity of being transgender is just one component of who you are. And so if you say, hey, look at that transgender over there, it's very objectifying in a way that you don't want to be. You wouldn't say like, hey, look at that black over there. You would say, look at that black man or look at that black person, in the same way that you'd want to say, look at that transgender woman and look at that transgender person over there. So just something to kind of keep in mind. If you were to use one of these words or say something like that, people would know right away that maybe you didn't work with LGBT people very often. And sex change is something similar. No one really says sex change anymore. I think it's because there's no such thing as a sex change. There's no machine that one day you walk in female and the next day you walk out male. That just doesn't exist. So instead, you're going to want to say gender transition like we were just talking about. And then, of course, there's sort of no such thing as sex change surgery either. You're not going to have a transgender consumer that comes in and says, I want sex change surgery. That's not what they're going to ask for. Instead, they're going to ask for something like gender confirmation surgery or gender affirmation surgery, or even more likely sex reassignment surgery. They're going to come in and ask for SRS, but not sex change surgery. So again, we don't want to focus too much on this. It wouldn't be a complete disaster if you accidentally use one of these words, but we just want to put it out there to kind of make sure you're using the latest and greatest in language. And we can go to the next slide, please. Great. So I just had a quick question just to check in, and then we're going to kind of talk about some of our other topics. So which of the following is not a term describing sexual orientation? And go ahead and just take maybe 20 seconds to kind of think about your answer, and then we'll talk about it. So the correct answer here is actually D, transgender. If you remember back, sexual orientation is all about who you love, right? Who you're in a relationship with. So straight, heterosexual, lesbian, all of those words describe how you feel about other people, which is what your sexual orientation is. Transgender, on the other hand, really has to do with your gender identity. which is totally separate from your sexual orientation. I think that's something to keep in mind, that transgender people, for example, also have their own sexual orientation. So someone who's transgender can be straight or gay or bisexual. So, there's sort of two separate concepts there. But again, the answer here is B. And we can go to the next slide. Excellent. So the first question we just put out there because we're always interested in what people think. How many people in the U.S. identify as LGBTQ? And then how many people in Connecticut identify as LGBTQ? Just take, maybe 10 seconds to kind of think about what you might answer in this situation. So the answer for both of these is C. In the U.S., there's about 9 million LGBT people. We actually think that that's a conservative estimate because we can only get that information from sort of survey data. That only counts people who are able to kind of raise their hand and say, hey, I'm LGBT. Where, I'm sure for reasons many of you understand, not everybody can do that. And then in Connecticut, there's about 100,000 people identified as LGBT. So keeping that in mind as you're out there doing your work, we're very certain that you're kind of reaching LGBT people whether you know it or not. And we can go to the next slide, please. Yep, and just something to keep in mind, I think a lot of you know this and recognize this already, but LGBTQ people really are everywhere. We come from every different community. LGBTQ people are people of color, are living with disabilities, live in rural areas, are parents, are religious people, are business owners, any sort of way to think about a different community, just know that LGBTQ people are there. And so when you're doing outreach, you don't have to be doing it at a pride parade, but you could be doing it wherever. And just know, again, you're always reaching LGBT people too. And next slide, please. And this is just something I want folks to keep in mind. We're sort of at that section of the webinar just talking about the different barriers that LGBT people have faced in the past. You can kind of see here, this is from a study in 2013, which really wasn't that long ago, showing sort of the day-to-day experiences that LGBT people have had in the past. A lot of time I think folks are like, yeah, we have marriage equality, people can get married, there's a lot of gays on TV, I have friends who are transgender, right? All these things, why are we still talking about this? Aren't we post-LGBT? And I would say, we've made a lot of progress in the past 20 years, but there's still a long way to go. And the reason is because of stuff like this. So you still have about 60% of LGBT people who are hearing slurs or jokes. About 40% have been rejected. 30% have been threatened or physically attacked. 20% have been treated unfairly by their employer because they're LGBT. And so, these are all the reasons that a consumer, an LGBT person, might be hesitant to walk into your office for enrollment or to come into your center for services if they don't know that you're going to be an affirming place and an LGBT-friendly place. It's sad to say, but these really are sort of the daily experiences, and this is why we kind of have to go above and beyond in our messaging for LGBT people to make sure that folks know that they're included in our efforts. You can go to the next slide, please. Unfortunately, the same is true for healthcare. So this is data, and I'm not going to read all this to you, but this is data from a study called When Healthcare Isn't Caring, which I think is about sums it up. But for many, many LGBT people, healthcare has not been a particularly safe or friendly place for many, many years. And you could sort of see here, you have 27% of transgender people being refused healthcare altogether. 27% of trans people have walked into a clinic or a hospital and been told, we don't treat your kind here, for instance. You could sort of see 11% of LGBT people have had, harsh or abusive language from healthcare folks, whether it's a doctor or a nurse or even a front desk staff. And then in some cases, folks being sort of physically rough or abusive in a healthcare setting. And so again, I think when it comes to LGBT people, this is some of the baggage that's at the back of people's minds. This is why we sort of do a lot of the work that we do to go out and say, you have to enroll. And I think a lot of folks who've had experiences like these rightly sort of push back and say, well, why would I want to engage in a system that doesn't want me, when this is what folks have been going through with healthcare? So it's just something to keep in mind that there's a lot of work to be done there. We think the Affordable Care Act makes it much better for LGBT people, but there are still a number of gaps. Next slide, please. And of course, I mentioned this earlier, the uninsured rate amongst LGBT folks is a big disparity. We did the study in 2013 that showed that overall 1 in 3 low and middle income LGBT folks was uninsured. And when I say low and middle income, I'm really talking about folks who would be eligible for tax credits through the marketplace, so folks under 400% of poverty. We repeated that study in 2014 and found that the ACA had actually made a big difference for people. It had dropped the uninsured rate down to 1 in 4. So we went from 34% uninsured to about 26% uninsured, which is great. It showed a lot of progress. But 26% is still really, really high and much higher than the general population. And so you can kind of see here, we broke down those numbers by LGBT. And, you know, again, you can see the numbers are going down in a good way across all 4 of those identities, but they're still really high. And I would particularly draw your eyes to the transgender numbers. You know, in 2013, 59%, almost 2/3 of low and middle income trans people did not have health insurance. And for most, it's not because they didn't want it. Unfortunately, being transgender itself is often considered a pre-existing condition. And so even folks who wanted to buy a policy often could not get one because the insurance company would not write them a policy. So 59%, very, very high. That's where we're 1 year to 2014, and we saw that number basically drop in half to 35%. So you could really see this huge impact that the ACA had for trans people right away. However, 35% is still really, really high. So there's a lot of work to do there still. And we'll go to the next slide, Kim. So I want to talk a little bit about what's in the ACA for LGBTQ people, and then we'll kind of get to the application itself. So a lot of the benefits are sort of the same. It's the same things that you all go out and talk to people about every day. Things like the coverage is, you know, much higher quality. There's things like essential health benefits. Financial help is available. I think having assisters and having free in-person help is really critical too. But the 2 sort of LGBT-specific benefits I want to talk about relate to non-discrimination and relationship recognition. So that's what I'm going to focus on. But please know that, you know, all the free preventive care and financial help, all of that really does resonate with LGBT people too. So as you're out there talking, those are great message points as well. And next slide, please, Kim. Great. So I said I wanted to focus just, actually, we'll go up 1. I want to focus on the non-discrimination. So this is actually a brand new thing for OE4. In May of this year, the Department of Health and Human Services came out with a brand new rule, basically saying that LGBTQ people are protected from discrimination in both health insurance and health care. And that includes all marketplace plans. And so you can sort of see from the slide who is protected, and it's really everybody. These new protections, you know, apply to lesbian, gay, bisexual people. They apply to transgender people, gender nonconforming people, intersex people. You know, anybody you could sort of think of as falling under that broad rainbow umbrella that we have with LGBT people is protected from discrimination in both health care and health insurance. And I want to just tell you a little bit more about exactly what that means. Next slide, please. Yeah, so the first thing as a sister is for folks who are actually sort of doing the enrollment behind the desk and behind the computer working with folks. This is a statement you might recognize. This is a statement that comes from the marketplace application itself. So this is one of the last things that the consumer will see before they sign their application and send it in. So if you're working with someone who is LGBT or, you know, identifies themselves that way to you, it's a great time in the enrollment process to just stop and say, hey, I want you to see this. Remember, just point out sexual orientation, gender identity, that, if you have any trouble using your health insurance, with a health insurance company or with a hospital or a clinic, you have rights, and I want you to do something about it. And so, I would want you to have them call me, call Katie about to enroll, or they can file a complaint with the state insurance regulators, or I think particularly in this case with the Office for Civil Rights at HHS. But we just wanted to point out that the marketplace application itself actually tells consumers they're protected. Of course, many of them are not reading that, and it's a great opportunity for you as a sisters to kind of point that out before you sort of send them on their way with their health insurance. And next slide, please. So I want to just give you a little bit of a heads up about what these non-discrimination protections mean in a healthcare facility, in sort of a hospital or clinic setting. I know it's a little bit odd. I know many of you are maybe like, this is supposed to be about health insurance. But again, you all are kind of on the front lines, and consumers trust you. They're going to come back to you with questions, and it's always good to just kind of have the information we found. So, beginning now, these sort of new protections that were rolled out this year, healthcare facilities and providers cannot turn people away from treatment because they're LGBT. They can no longer say, we don't serve transgender people here. We don't serve your kind, that kind of thing. They couldn't turn away me and my wife, for example, just because we were in a same-sex relationship. You also can't sort of refuse to use a transgender person's correct name and pronoun. You couldn't sort of continually refer to a transgender woman as he and him over and over again if she had already asked you to stop. This is in a hospital. As you can imagine, this kind of stuff happens quite frequently. And then you can't assign an LGBTQ person, and particularly I think a transgender person, to a room that, is inconsistent with their gender identity. And so what do I mean by that? It's really when you have, let's say you have to go into the hospital on an inpatient basis, maybe you're getting a surgery done, and they give you a roommate. And so that roommate would need to sort of match your gender identity. So if I'm a transgender woman, my roommate would need to be female. If I'm a transgender man, my roommate would need to be male. We were actually finding that folks were sort of using what was on the person's identity documents or something like that, and putting people really on the wrong floor, the wrong ward, or with the wrong roommate. Again, I know these are kind of outside the scope of a lot of what you all work on a day-to-day basis, but a lot of people are just completely unaware that these new protections are out there, so we're just trying to do our part to spread the word. And if you want to get more involved or get more information on this, please definitely let me know. Next slide, please. Great, and I do just want to focus briefly on some of the health insurance protections as well. So one of the big ones is a new focus on transgender health. And this is, again, I think for our federal marketplace state, something that's brand new for 2017, but for you all at Access Health CT, you've been way ahead of the curve, and things have been in place for a lot longer in Connecticut. But one of the things that we've been dealing with for a long time is a lot of plans, health insurance plans, have really discriminatory language called transgender exclusions. And so this is actual language in the policy, and I've got some examples up on the screen for you. The language in the policy that essentially says, we don't cover anything related to being transgender. The language can be really nasty. As you see, there's words that we have just told you we don't recommend that you use, but these are actual examples from different policies that we found. And so what a lot of these transgender exclusions have been used to do in the past is really to deny access to any type of care a transgender person would need. Definitely means folks can't get surgery that they've needed, but it's also cut off access to things like hormone therapy and mental health care, preventive care. There was a really sort of egregious case in California a few years back where a transgender woman fell and broke her arm. And the insurance, her plan had one of these exclusions in it, and her plan sort of basically refused to cover the broken arm because they said it was related to her being transgender. And the way that they got there was by saying if she was on hormones, if she hadn't been on hormones, her arm would have been stronger and she wouldn't have broken it. So if you're gasping along with me, so the transgender exclusion meant they wouldn't even pay for her broken arm because they said it was related to being transgender. So these are the types of abuses that a lot of trans people are very familiar with and have been facing for many, many years. I mentioned already that Connecticut is way ahead of the curve, and this type of really discriminatory language has been banned in Connecticut since 2013. That said, sometimes we still see this language crop up, and so I would not be surprised if you had a consumer come in and say, hey, I'm looking for the plan that doesn't have the exclusion. And this would be what they're referring to. It'd be sort of, does the plan have some kind of transgender-specific exclusion, meaning they're not going to be able to access the services that they need. So it's just something to keep in mind. I would not be shocked if a consumer asked for something like that. It's something we get questions from across the country about on a regular basis. And next slide, please. Oh, and I see someone writing in that you've been working on a case for a client who's been denied gender reassignment surgery. Again, something that is quite common, unfortunately. And I think if you need any help or you want to be connected with some of the other folks we work with around the country who have sort of best practices on how to do those appeals, please definitely let me know. That increasingly we've gotten pretty good and built up a significant body of evidence for why these types of procedures are medically necessary for folks. But we'll always be happy to connect on that, and thank you for raising it and for doing that work. So I think I've hit on most of this already. Again, it's a big change for OE4. Again, in Connecticut, you all have been ahead of the curve, but you should not be seeing any transgender exclusions. Plans are also not allowed to sort of deny coverage just because it's related to someone being transgender. So if a plan is covering a hysterectomy, for example, if they cover hysterectomies, and they often do because lots of people need hysterectomies, they can't deny it to a transgender man just because he's transgender. So they can't cover it for someone who's not transgender and then deny it for someone who is. And that's something we find quite a bit, is that folks are sort of singling people out just because they're transgender. So just something to keep in mind. There's no sort of affirmative coverage requirement. There's nothing out there that says, here are the 10 things you have to cover for transgender people. It's more about what I'll call parity. Coverage has to be the same for transgender and non-transgender people. But we often find that still a bit of a fight, as Amy is suggesting here. But again, thank you all for sort of doing that work. And if we could go to the next slide, please. So the other kind of big benefit, and this is not surprising to you all because the rules are exactly the same, but a lot of LGBT people maybe don't even know this. The idea here is that straight and gay and lesbian couples are treated exactly the same through the marketplace. It doesn't matter, at this point, like where you got married or when you got married, or as long as you're married and you file your federal taxes together, or frankly, as long as you file your federal taxes together, you can get your tax credits together, and everything's fine. It's really exactly the same rules as applied to anybody, but a lot of LGBT people are surprised by that. They don't realize that they're going to be treated exactly the same, and that's often something that's like a great messaging point where we go out there and we say, hey, Obamacare recognizes your relationship. You're going to be treated as a family, which is what a lot of people have maybe not had in the past when it comes to government programs. So for you all, it's sort of business as usual. But for a lot of LGBT people, it's sort of a pleasant surprise when they find out that they're going to get their tax credits together. And same thing, of course, that, again, they're all rules that you know, but if folks are unmarried and maybe they have a child, whoever claims the child on their taxes, on the federal taxes, is going to get the financial help for that child. Again, nothing sort of new or confusing for you all who've been doing this for a while. And next slide, please. So I'm going to talk a little bit more about some of the things that you all can do to do outreach to the community. The truth of the matter is LGBTQ people really do want health insurance. Unfortunately, about half have never shopped for private health insurance before. and 80% have said that they really want help, and they want to sit down with someone who understands a lot of the LGBT specific questions and answers. So, things like they want to know if you can help them with transgender exclusions, and they want, and partner coverage and things like that. So all of the things that we're talking about in this training, I would say. And next slide, please. Yep, so those are some of the stats that I just gave. One of the things that we want to do is actually make sure we're making really good referrals. And so on our website, we have our own sort of a sister locator tool. And so for organizations like yours who have taken our training and who have LGBT-friendly organizations already, what we want to do is ask you to register with us. And we have this tool that consumers visit, and they put in their zip code, and it pulls up all the sister locations in their area. And if you've taken our training and you're on board with doing this, it will actually list you with the little rainbow icon next to your name. Of course, no sister can discriminate, but we want to do our job in sort of pushing our LGBT consumers to organizations that we know are going to treat them extra well, which would be, all of yours who are willing to sit on a Monday on a webinar with us. So we can definitely make sure you have information about how to register, but it's really that sort of link at the bottom of the screen, and I'd really encourage you to do that if you're interested. And next slide, please. And of course, there's a lot of really fun ways to do outreach to LGBTQ people. These are some great photos and some of the events that Access Health CT has been doing all across the state. And I know we've sort of helped provide materials and things like that, but there's a lot of great stuff you can do. You can partner with LGBTQ organizations. There's everything from LGBT churches and transgender specific organizations to groups like PFLAG, which is Parents, Friends, and Allies of LGBT people. There's LGBT Chambers of Commerce, et cetera. Sort of the list goes on and on. There really are a lot of options for partnerships to make sure you can kind of make yourselves available as a resource to those communities. We would definitely encourage sort of using culturally competent materials, adding in, some LGBT specific messaging, maybe during LGBT Enrollment Week of Action, which is coming up on the week of December 5th. If folks are interested in getting involved in that, I know that I can help, or Kim Hines can help as well. But just mixing in, and again, images of same-sex couples, information about non-discrimination, things like that can, really encourage folks and send that signal that you're LGBT friendly. And then there's a lot of events to reach folks, whether it's at Pride or different festivals or things like that. There's a lot of options out there. It's just kind of keeping your ear to the ground. The next slide, please. And Access LCT has been doing a really great job of this. We always love kind of seeing photos of where folks are. So I just wanted to summarize. This is not new information on this slide. This is for OE4. We're really out there talking about non-discrimination. When it comes to LGBT people, we're really, saying this applies to both health insurance and health care. If you have a problem, you need to tell us, and you need to file a complaint with the Office for Civil Rights at HHS. And, oh, by the way, your plan should not have transgender exclusions anymore. So these are kind of in addition to all the general messages that you're all out there pushing already, but this is where we are for OE4 and what we're encouraging folks to pay attention to. And next slide, please. And let's go right to the next slide. Great. So, now maybe as someone coming in, we really want to kind of, give you some tips, and these are just best practices from across the country that we've heard, but how to create a safe and welcoming environment. There's really a lot you can do. Something we recommend is, displaying non-discrimination policies. For example, you could even just print out that statement from the Marketplace application and have it on a piece of paper next to your desk. You can have safe space or rainbow stickers and posters. It does not have to be a giant rainbow flag on the back of your door. It could just be something small. We recommend actually a small rainbow, like on your name tag or maybe on the back of your computer. And I guarantee you most straight people will not notice that at all. But the LGBT people that you're serving will pick up on it right away and sort of instantly feel like they're in a safe place. Same thing with reading materials. unisex bathrooms, if that's an option, that's always great, or gender-neutral restrooms. And then at any point, if someone seems uncomfortable, giving them the opportunity to kind of write down information or type it in themselves. And, I mentioned before that trans people, for example, might have identity documents that are different or might need to give you a legal name that is different from the way that they're appearing. And if folks seem uncomfortable, it's probably okay to just kind of let them write that information in themselves so that they're not outing themselves and potentially putting themselves in danger. And next slide, please. So this is a big one. This is not just LGBT people, right? I think we all need to be out there not making assumptions about people. You sort of can't look at someone and assume you know who they're in a relationship with, or whether they have children, for example, or what their gender identity is, or what pronouns they use. I was doing the training last week in Phoenix, and someone gave me an example where there was maybe an older gentleman and a younger woman came in, and everyone assumed they were father and daughter, and of course they turned out to be married. And so that was kind of their example, like, yeah, we really shouldn't kind of make assumptions about people. And, so just kind of keeping that in mind. It's no judgment, right? It's got to be a judgment-free zone when we're doing this work. At the same time, we would really recommend trying to use gender-neutral language to the extent that you can, and it's especially true when it comes to families. So instead of saying husband and wife, saying spouse. Instead of boyfriend and girlfriend, saying partner. Instead of mother and father, saying parent, for example. Language really matters here, and I think it's just something important to kind of pay attention to. And we were doing the training in Nashville, Tennessee, and I had a woman come up to me at the end and say this point had never had such an impact on her before, but she had taken her grandson to the park that weekend, and another little boy came up to them and said, can I have some of your snacks? And she said, sure, but you have to ask your mom and dad first. And the little boy said, well, I have two dads, and ran away. And she felt terrible. She, again, all of us are good people. We're trying to do really good work and bring healthcare to folks. And she felt like she had made this little boy feel like his family was not normal, which was not her intention. And so she just came up to say, like, this really is increasingly kind of important that we are not making assumptions about people, and we can adjust our language in a way that makes sense to do that. So just something to keep in mind. And next slide, please. Yep, so I've said this a lot. Language is really, really important. I do just want to give you permission to ask. So if you are in doubt, if you do not know or you're unsure about how to refer to someone or kind of what pronouns someone might use, it's always going to be okay to ask. I don't know any transgender person who would prefer that you guess what pronoun to use. It might feel strange to you, but, some of the ways that you could do that would be to say, what pronoun do you use, or how should I refer to you? Another really easy way to do it is to say, hi, my name is Katie. My pronouns are she and her. What's your name? And again, it might feel strange to you, but the person is going to automatically understand what you're doing, and they're going to give you the pronouns that they use in response. If someone does have a pronoun or a name that is maybe different from what's on their application, we do recommend just making a note to yourself. Not anything identifiable, but like this applicant prefers female pronouns, for example. Just so that every time the person calls in or every time they come into the office, they're not going through the same thing. That could be really important to making sure you get a successful enrollment. And then if there is a mistake, if you say something that maybe you shouldn't have, and we all do, I still make mistakes, what you're going to want to do is just apologize and move on. I've definitely said he when I should have said she and misgendered someone, and you feel terrible, right? It's like, oh my God, if you're anything like me, you're like blowing it out of proportion and really freaking out. You want to get under your desk and hide. But the person does not want you to do that. They just want you to say, oh, I'm so sorry, my mistake won't happen again. And then you fix it and you kind of keep it moving. Folks really don't want you to make a big deal about it. And Kim, next slide, please. We should be almost done. Yes, so I just have sort of this and then one more kind of substantive slide about the application itself. So I hope I made this clear over the course of our hour together. When a transgender consumer comes in conversation, right? When they come in and say, or to come in and say, hi, my name is Katie, you're going to want to call me Katie. You're going to want to use, she and her and ma'am, and you're going to want to treat me the way I ask to be treated, right? And I think a lot of us can get behind that. In conversation, you're just going to want to be respectful to what the person is saying. Treat them the way that they ask to be treated, I think, is the easiest way to sort of think about that. When it comes to the application, this is very important. I mentioned again, lots of people have maybe not updated all of their identity documents, but what we really need the person to use is the name that's on file for when they file their federal taxes. So typically it's the name on file with the Social Security Administration. They are going to know whether they have updated their name and gender marker with SSA or not. And the reason it has to be the federal legal name, sort of what's on file with the federal government, is because they have to get through identity verification. Even if they've changed their driver's license, even if they've changed something at the state level, it doesn't matter. It really needs to be what's on file with Social Security. And we would say the same thing for gender marker. Again, they're going to know if they've updated this or not. And I think it's really helpful to kind of let them know, and I know you all have your own system, and I assume you can update this information at Access Health CT as well. But most of the time, if someone does go through that process and changes their name and gender, you should be able to update their account. So you can kind of let folks know, like, for right now, we need to list this information, but going forward, if you change it, you can come back and change it here too, and folks like that. They always sort of appreciate knowing that. In terms of relationship status and household configuration, there's nothing surprising there. We sort of talked about it. It's exactly the same rules as, straight couples or non-LGBT families, for example. And next slide, please. And of course, you can get all those plans at accesshealthct.com. I mentioned the plan exclusions. One thing to point out is if folks are looking for transgender exclusions or frankly any type of benefit for transgender people, it's often not going to be on the summary of benefits and coverage. You're going to have to dig a little bit deeper into what's called the more detailed evidence of coverage or certificate of coverage. Plan formularies, you guys are familiar with that. And then provider networks. I just put this out there because we get this question a lot, which is how do I find an LGBT-friendly doctor, which is a struggle for many, many people. One resource that you might just want to know about is something from the Gay and Lesbian Medical Association, galama.org. It's really just a directory, so folks can put in their zip code, and then it will pull up all the affirming providers in their area, and it's at least a good place to start. And then we can go to the next slide, and got some good resources, which I don't have to talk about. And I think, Kim, I was going to turn it back to you.
Okay, that's wonderful. Katie, you did such a great job, as always. Thank you. I'm just going to take a brief moment to talk about opportunities to partner with Access Health Connecticut and what we can hopefully do for you. Before I do that, though, I just put a link to a survey up on the chat box. And if all of you could just take a brief moment at the end to go there and fill out a very, very quick survey, we would really appreciate it. So, partnering with us. We have this year launched a new community partner website at learn.accesshealthct.com/community. You can find all kinds of things there. We'll go through that. And on that website, you can sign up for our email list. And so you can get our newsletters, our announcements. We really don't send out too much email. I would say certainly less than once a day. So it's not like you're going to be signing up for a bunch of spam. So what is a community partner? And frankly, Access Health, we could not do our jobs without all of you as community partners, because you are the ones out there on the street trying to enroll people, trying to help people, trying to tell your community about open enrollment. And we are incredibly grateful that we have all these wonderful community partners who do that. And we try to provide the resources and information that you need in order to do that the best that you can. Some of our different community partners include CHCs, the Department of Labor, libraries, colleges, schools, all kinds of organizations are our partners. So this is what our community partner looks like, the web page. And as you can see, you can click on events and trainings, and we put our upcoming webinars there, and you can access information from previous webinars. There's all kinds of materials you can print out. For social media, you can put our logo on your website or on your Facebook page. You should feel free to follow us on Facebook, Twitter, etc. Our social media person does a really great job of promoting Access Health through that. And then if you have questions, this is the place to come to figure out, well, who exactly should I ask this question? And I just went through that a little bit. So in terms of webinars, our upcoming webinars include how to get financial help, how clients should get financial help, Wednesday, December 7th from 1 to 2. And then we have on December 12th an overview of Access Health Connecticut Consumer Decision Support Tool, which is a really interesting one because that helps consumers figure out which plan they should go with. So it's great to be familiar with that. And printable materials, as you can see, just all kinds of flyers on all kinds of topics, immigration, the tax penalty, what happens after you age out of your parents' coverage, lots of really good stuff there. If you sign up for our email, you can get our monthly newsletter, which will have any sort of news regarding the ACA or regarding Access Health Connecticut, any sort of enrollment news, things like that. And finally, we're going to answer your questions on, okay, I have this problem. Who should I go to? And it'll let you know. There's a couple different people. There's a phone number for brokers. There's a phone number for CAC help. So it's really a great resource. In terms of what we want from you, please invite us to any events you're having so we can have a table or we can talk to folks about open enrollment and about health disparities and health literacy. You can reach me by emailing outreach@accesshealthct.com, or there's a form on the community partner website. So now, if anyone has any questions from either me or Katie, please feel free. And Amy, I hope you can connect with Katie to get some specific help on that issue. That's really important. And again, any questions, just type in the chat box. But seeing none.
Great. So.
Oh, wait, we do have a question. Okay. What gender did you say I should mark when enrolling a transgender consumer? What if they don't want to list their legal gender? What do I do then?
So this is a great question. Thank you, Quinn, for that. So what we recommend in terms of gender is listing what the person has on file with Social Security Administration. Again, just sort of consistent to remember it is sort of a federal program because we're matching it with all kinds of federal data. So sort of what's on file with the federal government. That said, we have been told that folks really aren't sort of matching the gender on the application to the gender that's being listed at Social Security. So in theory, I could list, I could say Katie Keith, and I could list male if I wanted to, even if I hadn't updated my gender. It should not hold up the person's application from being processed. However, what we have heard is that, or what we advise folks to tell consumers in that situation is whatever they put on the application is going to be what gets sent to the insurance company. And so the insurance company is going to see this and come up with their insurance card. And again, folks will understand the implications of that. In some circumstances, having male on your insurance card is going to make it harder to fight for certain services that a person might need depending on what their anatomy is versus having female on their insurance card, which will bring the same sort of but different problems. And so in those situations, we would say the person should decide for themselves what they want to list for their gender, because it kind of deal with the ramifications of it, of going back and forth with the insurance company. So I know that was a long answer. I think just to summarize, I'll say, what gender do we recommend that folks list? It's what's on file with Social Security. If the person doesn't want to list that, it should be fine, but you should inform them that whatever they list is going to probably be sent to the insurance company, just so that they know and they're aware of that information too. Great question, though. We found that from a lot of transgender people enrolling. Like, no, I'm a woman. Why would I list anything other than that? Right? It's kind of the response that you can get, but it should not hold up the application process.
That was a great question. Does anybody have any further questions for Katie? And I think Katie really has done a really fabulous job of outlining how we can treat LGBTQ people as just regular people, part of our community, whether or not we are straight, transgender, lesbian, gay, what have you. Everybody is the same inside and wants to be treated equally. I really appreciate Katie coming on and doing this for us. She's a wonderful, wonderful resource.
Thank you for having me and for everything that you all are doing. And I just put out the link one more time just for the sign up for our sister Locator tool. We'd love to be able to refer folks to all of you. So thanks again for having me.
That's really terrific. Thanks. And again, please just take a second to go to the Survey Monkey and fill out that brief survey so we know what we did great and what we can do better next time. Thanks a lot, everyone. I'm going to end the webinar here, and we appreciate your taking the time out to come and join us. And please sign up for our future finance and consumer decision tool webinars as well. Thanks a lot, everyone.